Welcome to another easy nursing review. In this lesson, we will cover Myxedema Coma. But before we begin, let's see if you can get this answer correct. After being diagnosed with Myxedema Coma, the patient with hypothyroidism is admitted to the intensive care unit. Which assessment outcome would call for the nurse to act right away? 1. Serum blood glucose level of 74 milligrams per deciliter. 2. Pulse oximeter reading of 90%. 3. Telemetry reading showing sinus bradycardia. 4. The client is lethargic and sleeps all the time. Comment what you think the answer is in the comments below. What is myxedema coma? Myxedema coma is the most extreme stage of hypothyroidism manifestations, precipitated by factors such as cold, surgery, infection, or trauma in any client with severe prolonged hypothyroidism. Now, here are the signs and symptoms of the patient. The patient will present with hypothermia and bradycardia, increasing lethargy, stupor and coma, abnormal sensitivity to opioids, sedatives and anesthetic agents, and depressed respiratory drive, cardiovascular collapse, and shock develop. Now let's go over important labs and diagnostics. Labs will reflect the following: decreased levels of serum T3, T4, FT4, and T3 resin uptake, delayed TSH response to TRH stimulation test, increased TRH and TSH serum levels if primary hypothyroidism and hypothalamus and pituitary are intact, elevated levels of cholesterol due to the hypometabolic state, decreased results to the radioactive iodine uptake test. Determine whether the client has taken medications or foods containing iodine, as these may alter test results. Okay, let's move on and learn about treatments for myxedema coma. The primary objective is to restore a normal metabolic state by replacing the missing hormone. Synthetic levothyroxine is used for this purpose. Note that the dosage is based upon the client's TSH serum concentration. The next objective is the prevention of cardiac dysfunction, which can be managed with cardiac monitoring. The last objective is the prevention of medication interactions. An increase in metabolism may affect insulin needs and can also increase blood glucose levels, dilantin levels, and more. Excellent. Now let's move on to nursing actions. The nursing actions include the following: alert the physician to medications taken that can alter results of diagnostic tests, especially estrogen, salicylates, amphetamines, antibiotics, corticosteroids, and mercurial diuretics. Modify client activity to accommodate fatigue and promote independence in self-care activities. Provide extra layers of clothing or an extra blanket, and monitor body temperature, reporting any decreases from baseline. Provide foods high in fiber. Monitor respiratory rate, depth, pattern, pulse oximetry, and arterial blood gas. Orient the client to time, place, and events. Monitor for increasing severity of signs and symptoms of hypothyroidism, such as decreased level of consciousness, vital sign changes, and increasing difficulty in arousal. And with nursing action comes patient education. Teach the patient to take levothyroxine on an empty stomach. Educate them about the side effects that relate to under or over replacement, as anything under or over will mimic the signs of hypo or hyperthyroidism. Explain the reason for thyroid hormone replacement and the necessity for long-term follow-up to both the client and their family. All right, well, you made it to the end of the video. Back to that question at the very beginning of the video. After being diagnosed with myxedema coma, the patient with hypothyroidism is admitted to the intensive care unit. Which assessment outcome would call for the nurse to act right away? 1. Serum blood glucose level of 74 milligrams per deciliter. 2. Pulse oximeter reading of 90%. 3. Telemetry reading showing sinus bradycardia. 4. The client is lethargic and sleeps all the time. The correct answer is 2. Less than 93% on a pulse oximeter is considered significant. An arterial blood gas with a PaO2 of roughly 60, as indicated by a 90% pulse oximeter result, is considered severe hypoxemia and needs to be treated right away. If you got it right, awesome. If not, that's okay, just keep studying. Well, that ends this lesson. Click here for another nursing video.